Hi, today we are about to present how National Anti-Drugs Agency AADK manage drug-free nation. This slide was made by our members IZZATI, me, BATRISYIA, NURIN, ALISHA, and ZAHRA.
Introduction. First thing first is what is AADK? National Anti-Drug Agency (NADAH), or well known as Agensi Anti-DADAH KEBANGSAAN AADK, is a government agency under the Ministry of Home Affairs that manages drug-related matters in Malaysia. National Anti-Drugs Agency was established on 22nd June 1983. The main functions are to execute prevention, detecting, arrest, enforcement, investigation, and prosecution of offenders involved in drug offences. Other than that, it is to give treatment and rehabilitation place for drug addicts. In the next slide, I'll be presenting about the objective of AADK establishment. First objective is to prevent anyone from involving in drugs, means to execute early prevention. Second is to treat and cure the drug addicts. This can be done by creating the rehabilitation program. Third, preventing rebilling. And last but not least is to eradicate the supply, trafficking, and abuse of drugs. Agensi Anti-DADAH KEBANGSAAN will collaborate with others agency like BINTI to execute the eradications.
Issues that are faced by AADK. First is trend of using new types of synthetic or fake drug. The drugs are created using man-made chemicals which give the same effect like other drugs. Second issue is drug addiction that is becoming more prevalent among youth. The uncontrolled drug and substance use (DSU) may pose unprecedented threat to national future and the country development. And last but not least is the prescription drug abuse. Some individuals who misuse prescription drug, particularly a teen, believe these substances are safer than illicit drugs because they are prescribed by a healthcare professional and dispensed by a pharmacist.
So next, I will explain about planning. First, definition of planning. According to Stoner, planning defining organizational goals, establishing a strategy to reach those goals, and developing a comprehensive hierarchy of plans to integrate and coordinate activities. Planning is the most basic managerial function. It is because when it's done properly, it sets the direction for the organizing, leading, and controlling function. So next, planning begins with goals, which are derived from the vision and mission statements. However, this statement describe what the organization wants to achieve, not necessarily what it can achieve.
So next, I will explain about the importance of planning. So there are several of importance. However, I only list two importance of planning, which are planning provide direction and planning will encourage the development of task strategies. So firstly, planning will provide direction because under the process of planning, the objective of the organization are defined in simple and clear words. So the employee of the company will get a direction and all their efforts are focused on the right way to achieve the planning they have discussed. So the second importance is planning will encourage the development of task strategies. It is because planning always done for future and future is uncertain. With the help of strategies, possible changes in the future are anticipated and various activities are planned in the best possible way. Consequently, the problems of when, where, what, and why, also the solutions are almost decided. This puts an end to disorder and suspicion. So the next slide is about the importance of national anti-drugs agencies. So the first importance is helping to manage the drugs matter, and the second one is to carry out operations to detect and arrest suspected drug addicts. So the first one is helping to manage the drugs matter by providing services in relation to the treatment, medication and rehabilitation, education and prevention, as well of enforcement and safety for its client in a more efficient and effective manner in line with the vision and mission of NADAH. So next, DADAH also responsible to carry out operations to detect and arrest suspected drug addicts to prevent the number of addicts increase. The reason for the arrest drug addicts is to help them become a normal person who is live a healthy and drug-free lives through the Rehabilitation Unit Recovery Center that NADAH has established. So in this slide, I will explain about types of planning, which are strategic planning and operational planning that used by NADAH. So strategic planning, which is process implemented by NADAH for makes decision and takes action to enhance its long-term performance. The long-term planning that NADAH make is in this planning is prevention for drugs addict. This planning's purpose is for helping the drugs addict from continuing to abuse drugs continuously. In terms of achieve this purpose, the person needs to fight their addiction with the help of units in NADAH, such as treatment, rehabilitation, and medical units. So next is operational planning that NADAH will plan the daily activities of drug addicts, lead an active and drug-free daily life. It is because drug use causes the addicts to experience extreme hallucination and delusion due to excessive drug use. So the purpose of NADAH planning is to help drug addicts return to a proper and healthy way of life. So next is planning by National Anti-Drugs Agency, which NADAH collab with government, which their aim is government schools. They want to collab with government school to provide education about drugs to the younger generation. This is because using new types of synthetic or fake drugs has become trend among students who is love to try new things, especially when their friends involved. So the other purpose is to identify students who are involved with drugs, which NADAH will identify the students through their symptoms such as bloodshot eyes, having patches of red spots on the skins, and trembled limbs. Then lastly, NADAH has organized IDEN program that the purpose is to help individual become a better person with following the institutional treatment and rehabilitation program and the community treatment and rehabilitation program. So the second purpose is to focus on skills and abilities in rehabilitation process to encourage clients' involvement through religious programs, specifically in understanding and practicing Al-Quran.
It's my turn to explain what is organizing, and I will try to make it short. Organizing means keep things in order. It must have a good relationship with each other in the organization because of they work in a team, and to make sure the task must be done on time without have any interruption that can make the goal can be achieved due to bad relationship between employee and employee or employee with manager. Examples of activity that employer organizing is preparation of accounts, making sales, and record keeping. Move to the next slide. Characteristics of organizing. First is division of work, which means every department have different tasks to handle. Secondly is communication. Communication is the key for people in an organization because they work in a team. Also, they will meet clients to make discussion. Thirdly is authority responsibility. The position of each manager and leader is determined according to the level of authority and responsibility assigned in completing tasks. Fourthly is objective, which it needs to be defined clearly, and it also means as goal that need to be achieved in organization. Lastly is coordination, which means everyone will assign with different tasks to perform but with same goal to achieve the objective of an organization. And then we go to importance and solutions. First is trend of using new types of synthetic or fake drugs. The importance of organizing in this issue is to describe work relationship between society, because we need to get their attentions and trust to prevent drug issue in Malaysia. Other than that, staff that handling both need to have good communication skill to give correct information to society. Secondly is drug addiction that is becoming more prevalent among youth. The solution we can use here is use young social media influencer to influence the youngsters, because youngsters these days really easy to get influenced, especially from what they see in the screen. So we can use influencer from Instagram or Twitter or TikTok to maybe give talk to any event that AADK handle, or make them as campaign ambassador to influence youngsters. Lastly is prescription of drug abuse. Some people take drug because of depression or maybe have mental health issue. So the importance of organizing for this issue is government need to grow financial to buy medications and pay psychotherapy to treat the addicted. Lastly, we go to strategies. There are a lot of strategies that have been done by government for drug finishing. Government do collaborate with various parties among government agencies, non-governmental organizations, and international cooperation. Example for government agencies is PDRM, Polis Diraja Malaysia, JKDM, Jabatan Kastam Diraja Malaysia, UPP, Unit Pencegahan dan Penyeludupan, and MOH, Ministry of Health. For example, for non-government agencies, NGO, is Pemadam, Persatuan Mencegah Dadah Malaysia, and Pengasih Malaysia Association. Lastly, example for international unit is Central Narcotics Bureau from Singapore, Office of Narcotics Control Board from Thailand, and National Narcotics Office of Indonesia Republic from Indonesia. Other strategies that have been done by government is by establishing ministerial committee to focus comprehensively on drug problem, finding new approaches and strategies. The government used three main approaches that called 3 R's. First is reduction of drug supply, which means using various strategies to disrupt the production and supply of illicit drugs. Secondly is reduction of drug demand, which means trying to prevent people from wanting to and taking illicit drugs. Thirdly is reduction of harm as a result of drug abuse, which means is to reduce the harmful consequences of drug use without necessarily reducing drug consumptions. There are 5 strategies to make the 3 main approaches successful. Firstly is namely preventive education. Second is treatment and rehabilitation. Thirdly, enforcement. Fourthly, harm reduction, and lastly, international cooperation. As a wise man, A.A. Milner said, organizing is what you do before you do something, so that when you do it, it's not all mixed up.
Now I will explain about decision making. Decision making is a process of identifying and selecting a course of action or alternative to solve a specific problem. We will making the best decision until we arrive at the best and most relevant solution and alternative. There is 3 scholars of decision making. First, Haynes and Massey. They define decision making as a process of selection from a set of alternative courses of action which is thoughtful to fulfill the objective of the decision problem more satisfactorily than others. Number 2 is Philip Kotler. He defined decision-making as a conscious choice among alternative courses of action. Number 3 is Josh R. Terry. He defined decision-making as the selection based on some criteria from 2 or more possible alternatives. There is 7 steps to make a good decision. First is identify the decision. Second is collect all the relevant information. Third is identify the alternative. Fourth is weigh the evidence. Fifth is choose among alternative. Sixth is taking action. And 7 is review your decision and its consequence. This last step is consider the outcome of your choice and assess whether or not they meet the need you specified in step 1 or not. You might you might want to go through the procedure again to reach a different option if the choice didn't satisfy the indicated need. The government has established National Anti-Drug Agency (NADAH). The National Anti-Drug Agency (NADAH) is the lead agency under the purview of the Ministry of Home Affairs in combating drug and substance abuse in Malaysia through the prevention, drug education, enforcement and security program, treatment, medical and rehabilitation program, and international relations.
Now I will explain more detail about my previous slide. First, NADAH Prevention Drug Education. A long-term approach to protecting someone from engaging in drug usage is prevention. For example, NADAH can do campaign at school. It is because the student must have knowledge about drug. It's great for students to know the consequence of taking drugs. Number 2 is Enforcement and Security Division. Their objective are to take action on public complaint of drug abuse activity, to detect drug addicts who refuse to volunteer undergo treatment and rehabilitation, and to improve security level in institution and in the community. Number 3 is Treatment, Medical and Rehabilitation Division. Drug addiction is seen as a long-lasting illness that recurs frequently and is defined by obsessive drug seeking and use in spite of negative effect. Number 4 is International Unit, principally in charge of directing NADAH multilateral and bilateral international cooperation, which complement the other 4 guiding principles, which is prevention, treatment and rehabilitation, enforcement and harm reduction. Malaysia participates in ASEAN Minister Meeting on Drug Issue AMMD to focus on 5 main areas which are preventative, education, law enforcement, treatment and rehabilitation, research and alternative development.
The last one is controlling. The definition of controlling. Control is installing process to guide the team towards goals and monitor performance towards goals. Controlling is the process to assure that actual activities conform to planned activities. Furthermore, controlling is one of the important functions of a manager. In other words, the meaning of controlling function can be defined as ensuring that activities in an organization are performed as the plans. By controlling, the manager can make sure the coordination among the employees by having a proper control on the team. The next one is the importance of controlling. One of the importance of controlling is to accomplishing organizational goals, and the second one is use human and physical resources efficiently. So, we move to the first one, which is to accomplishing organizational goals. AADK, which is Agensi Anti-Dadah Kebangsaan, built a squad named Squad Anti-Dadah. This squad is a group of volunteers that plays a role in executing drug preventive education and public awareness on the ill effects of drug abuse. They also trying to give the best service from the aspect of treatment and recovery, prevention and also enforcement. On the other hand, AADK also helped to giving a treat and rehabilitate to drug addicts. This squad also intended to spread awareness about the dangers of drug abuse. They also provide some early support to those who are facing drug problems. The second one is use human and physical resources efficiently. AADK is giving some social service and protection. They giving the community who want to getting counseling or physiological support. One of the way is they provide a rehabilitation center, and they have a few therapy such as a physical therapy, occupational therapy and also the speech therapy. It is very useful to help community to avoid themselves from drug. It also can decrease amount of drug addicts in our country. The next one is steps in controlling. There are 2 steps in controlling. One of them is establishing standards and methods or ways to measure performance, and the other one is taking corrective action and re-evaluating the standard. The first step in controlling is establishing standards and methods or ways to measure performance. This step will help in identify the plan is actually working or not towards the organization objective. One of the way that AADK do to manage drug-free nation among the educational institution is program with them. One of the program that they do is program Intelek Asuhan Rohani Pintar 2.0. This program is to inform the student about the side effect and the dangers of the drug. They also carry out a program by organizing a camp for students so the student can learn how to build a life skill. The second one is taking corrective action and reevaluating the standard. The government also create a public awareness and anti-drug campaigns. This campaign requires well-planned and comprehensive planning so that they understood and rise up against drug abuse. This program also to provide awareness among the community about the dangers of drug abuse and impact on health. One of the way is they do a campaign through print media. This can be divided in several categories such as magazine, brochures, and poster. Among the message conveyed drug facts, effect, guides or tips, AADK service, and so on.
In conclusion, Agensi Anti-DADAH Kebangsaan plays important parts in ensuring the objective and goals of drug-free nation in Malaysia can be achieved. With that, it is the time for Malaysia to embrace a comprehensive drug policy that is evidence-based and encompasses prevention, supply reduction, treatment and harm reduction while working closely with the affected communities. Lastly, we all need to join hands together to make Malaysia a better place. That's all from us. Thank you.